Carb counting can be helpful when trying to manage blood sugar. Whether you're planning a carb-steady menu or matching carbohydrates to an insulin dose, this video can help guide you. But first, what is a carbohydrate? Carbohydrates, or carbs, are a macronutrient that digest into glucose, or sugar, which is absorbed into the blood. Carbohydrates are an important nutrient and do not need to be avoided. There are many foods that contain carbohydrates, including breads, grains, pastas, starchy vegetables, fruits, and more. Packaged foods that have nutrition labels are helpful when carb counting. On the label, you will see total carbohydrates listed, indicating how many carbohydrates are in one serving. When reading labels, please check whether the serving size says cooked or dry. If the label says dry, you will need to calculate how many dry portions you consumed once cooked. However, what do you do if there's no nutrition label? Fresh produce does not require a food label, so you may not be able to find carbohydrate contents as easily on these products. When a food does not have a nutrition label, you can use a carb counting app or follow a few simple guidelines. To start, one serving of carbohydrates, which is sometimes referred to as an exchange, is equal to about 15 grams of carbs. For example, a baseball-sized piece of fruit, or one handful of fruit, typically equals one serving. A half a cup of cooked grains or starchy vegetables has 15 grams of carbs. A third of a cup of cooked rice or pasta is equal to one exchange. A longer list of carbohydrates and their exchange or serving portions can be provided by your healthcare team. Typically, it's recommended that meals have between 45 to 60 grams of carbohydrates and snacks less than 30. An example of a healthy meal that fits within this general recommendation is 1.5 cups of mashed potatoes, salmon, and roasted asparagus. If your care team recommends a different carbohydrate amount for you, you can use nutrition labels and the measurement guidelines to create a meal that meets your needs. If you need to match your insulin dose to the amount of carbs in your meal, it is helpful to have a calculator nearby. For example, if your diabetes team suggests you use 1 unit of insulin for every 15 grams of carbs you eat, you would divide the total number of carbs in the meal by 15. If your meal has 45 grams of carbs, you would find that you need to inject 3 units of insulin about 15 minutes before you eat. If you need to inject 1 unit of insulin for every 10 grams of carbs, you would need to use 4 or 5 units. Ask your provider if you should round up or down if you don't calculate a whole number. The more you practice reading labels and measuring foods, the more comfortable you will get with counting carbohydrates. First, understand which foods have carbs and which foods don't. Next, get comfortable with reading labels and using measuring cups. Soon you will be able to estimate or eye the amount of carbs you're eating. You will not have to carry a measuring cup with you to restaurants and family barbecues, but you may need to bring along your calculator. Luckily, that's stored in the phone already in your pocket.